Good evening, everyone. Today we are here to talk about experiences of living and surviving with COVID-19. Uh, Patients engaged in the last 2 months, we focused on supporting patients with chronic conditions, navigate the challenges that came due to lockdowns and things like, unavailability of medications, access to follow-up tests, stalled treatments, etc. By doing a series of webinars with various healthcare experts, and here are, a few samples as we talk through the 2 months. As we now go through phases of reopening and spike in cases and unlocking, we are seeing a lot of concerns about compromised immunity, high levels of anxiety about resuming work at all levels. And we now know that we actually have to live with COVID-19 for a while. So we decided to go back to learning from lived experiences and speak with people who have recovered from COVID-19 and to understand their journeys, what worked for them, what did not, how they are doing now, and how their experiences have changed their habits or their perspective, if at all. So I won't take too much of my time on this, but quickly run through the guidance and introduce the panelists. So our panelists today are Dr. Ekta Jajodia, who's a molecular pathologist and with a focus on molecular hematology. She has typically been testing for tumors, solid tumors, etc., and for thalassemia. But for the last 2 months, she's been busy with the testing for COVID, doing RT-PCR tests in Ahmedabad, and she went through her COVID positive journey, which she'll talk to us about. And her husband, Dr. Ankit Jitani, who's a consultant hematologist and bone marrow transplant physician at Apollo CBCC Cancer Care, Ahmedabad, who also was tested positive with COVID. Pradnya Hatiangadi from Mumbai, who had COVID symptoms, and her mother was COVID positive, and she'll talk about how a family of 8 managed with different levels of symptoms and different comorbidities and etc. And I'm Aparna Mittal. I'm the founder of Patients Engage and the moderator. So quick guidance, please note this does not replace your personal consultations. Please consult a doctor to discuss specific symptoms and specific concerns. This session is being recorded and will be uploaded on our YouTube channel. So if you're logged into Zoom, you can post your questions on the Q&A at the bottom. If you're on Facebook, you can post your comments or questions on the live feed. Let us know if you like the session, don't like the session. At various points, I will be running a couple of polls, so please do share your experience and your feedback. And if you have anything to write, to share or to write to us, you can always do so at editor@patientsengage.com. And all of you who know us, you know that we are on the website patientsengage.com, plus we are on Facebook, Twitter, Instagram. Okay, so we will quickly first go through the experiences of our panelists, and then we will look at question answers as well. So let's start with you, Pradnya. Just wanting to understand what were initially the hygiene and precautions you already had in place in your family, and what were the initial symptoms, and how did you go about figuring out that you may have COVID?
Yeah, so because I'd firstly like to say that because of the lockdown, a couple of my cousins, my brother, my bhabhi, like a lot of people, because they got stuck and stranded here in Bombay, were living with us. So there were about 8 of us together, and it's a 2-bedroom hall kitchen with 1 washroom. So we had to be extra careful since the beginning. What we did is my aunt and my mom are the senior citizens here. My mom is 64 and my aunt is 75 years old. So we knew that we had to be careful about that. They definitely did not step out since the beginning, even earlier than the lockdown. We stopped them from getting out. But we, maybe 2 or 3 of us took turns maybe here and there to get groceries. So that we sort of did. And well, masks, we started wearing masks probably by mid of March. I mean, that's every single time we stepped out, and we made sure all of the hand washing, sanitization, all of that was in place. Since we were using the washroom commonly, that was one area we did keep extremely hygienic, and we made sure we sort of disinfected at that level. It was not way too much. We used a solution that we normally would have used to clean the washroom, maybe. And my mom was in one room in any case, and my aunt was in a separate room, and everyone else was
I think we've lost you, Pradnya. Ekta and Dr. Ankit, we will go ahead first with you and she can join back later. So if you
Sure.
can tell us what were your initial symptoms? I think you have a very fascinating story about that. So go ahead.
So basically, since we were doctors, so the lockdown was not applicable to us. We
Right.
used to go routinely to hospitals, although we did some shift basis work, but every day was routine. And one fine day, it was on around 8th of May. The symptom which I first noticed was a total loss of smell. I
Hmm.
had just wore a perfume and I could not smell that.
Hmm.
So, but then it was just an initial symptom, and I thought maybe that's okay. But then in the back of my mind, I also knew that this is a common symptom of COVID too. And when I talked about this to my husband Ankit, and he told that he is feeling a mild sore throat from the same day on 8th
Hmm.
itself.
Hmm.
So on 9th, I went to the department as a routine work, and I thought, why not give my sample too? So when I got my sample tested by after my sample was given after about 8 hours, I got the report and it came as positive.
Hmm.
So after that, the first thing that we did was we knew that we have to isolate ourselves in our home. And since Ankit did not get tested till then, so next day we asked our lab people to come to our house and get his sample also tested. And
Right.
even he got.
Right.
So we
Right.
were quite okay. For 2 days, there was no problem. From 9 till 11, we were all okay. Just a loss of smell, that was total anosmia. And he was having mild sore throat, that's it. And then from 12th, I think he will speak.
Hmm.
So,
Okay. Go
so,
ahead.
so
Yeah.
basically, yeah. So basically, so from 11th we started having a mild increase in symptoms. So
Hmm.
for her, the anosmia persisted, and there was some headache. And I started having fever, which was low grade to begin with, but in 3 to 4 days' time, the fever picked up, and
Right.
it touched 102. So we were monitoring ourselves with all the gadgets which are required to do
Hmm.
so, and we're in constant touch with our hospital team with whatever we are doing. So on 14th night, the fever didn't really touch baseline, and that was when we thought that it's good to let a hospital team look after us. So
Right.
on 15th, we went to the hospital. Ekta was otherwise okay, but then I didn't want to leave her alone at home. She was positive and she could develop symptoms later. So we both went to the hospital and we were there for a week. So in 4 days' time, the fever absolutely came to baseline. So total 7 to 8 days, the fever was there.
Right.
And then they observed us for another 2 to 3 days, and then we were afebrile and we got back home. Then the government EHC doctors came to us, and then we were in additional 7 days home quarantine. Yeah. So after that, she arranged testing from her lab, which she can just tell.
Before that, I'd like to
So after
understand. Before that, I'd like to understand. Did you have body ache, myalgia during the period where you were febrile, or after that, did you have any of that? Either of you?
okay. So my anosmia was accompanied by headache, and that headache would go with paracetamol. So I had
Okay.
to take 3 to 4 tablets a day. But
Right.
then with paracetamol, I was and
So
for him.
for me, the myalgia was there to begin with, but
Hmm.
I observed that with good hydration, good fluid intake, oral fluid intake, it used to settle down.
Right.
So myalgia was not much of a trouble for us, yes, but it might not be the case for everybody.
Correct. Correct.
But
Yeah.
hydration,
And did you also use
But
an
after
oximeter? Sorry, did you also use an oximeter to measure oxygen levels?
Yes, yes. So we were constantly monitoring our temperature, pulse, blood pressure, and oxygen saturation through the pulse oximeter. So we were doing that almost 6 hourly each day.
Okay. All right. And did you see any impact in any of those, or you were quite clear on all of that?
Sort of, apart from the fever with which the pulse rate went a bit high. So with each degree change in temperature, it is known that the pulse will go high by 10 per
Right.
minute, beats per minute. And otherwise, all the things were more or less normal. Yeah.
Okay. Okay. And you were saying that after the fever went down, you went back for testing, right, Dr. Ekta? So
Yeah.
go ahead, continue with.
not after the fever went off, but after our 17 days of quarantine, we got
Okay.
it tested again so that if it comes negative, we'll be eligible for plasma donation.
Right. Right.
So the
Okay.
purpose of retest was not to show that there were two reasons. Yeah. So one was that I do deal with oncology patients who are immunocompromised. So that
Correct.
was one reason that I wanted to be really sure. And second is you need to have negative RT-PCR report to get eligible for plasma donation. So that was another reason which we got ourselves tested.
Right. Okay. And for you, Dr. Ekta, to go back to work, there was no such requirement in
No,
terms
no,
of
not for
getting a
me.
negative. No. Okay.
Even the guidelines do not say that we have to get it tested.
Right. Right. And did you ever try and analyze when you got tested positive, that how did it happen? Did you try and do contact tracing? And
Yeah, we tried on our level,
right.
but since I get to know that what Ahmedabad is going through now, so I think it was almost impossible for us to trace that.
Right. Right. And then after that, did
We
you
did
actually tell your colleagues, and did you find other people in your organization affected?
Yes, immediately I got tested. I asked the whole lab to get tested, and none of them came positive except one. He was
Right.
also totally asymptomatic, and the whole of the 18 days of his COVID infected period, he was totally asymptomatic. He never got any symptoms, but then
Right.
he quarantined himself at home.
Right. Right. Okay. Okay. Thanks. Pradnya, back. Good to see you back. If you
I'm
want to.
sorry about the network.
No,
Really
not a
sorry about that.
problem. Not a problem. So go ahead. You were talking about how y'all were all kind of trying to manage the
Yeah,
elderly in your family.
correct. So, like I was saying, we had no reason to. I mean, we thought we were being safe, and just like Dr. Ekta said right now, we actually couldn't trace back to what it could be then because we were just practically going on for groceries and maybe absolute essentials. There was nothing extra that we were doing.
Hmm.
And what we were sort of doing was a maximum of 2 people or maybe 3 people in the house was stepping out. Everyone else was asked to stay home, definitely. And what happened is my brother first initially sort of showed symptoms of a cold. I mean, it was as good as his upper respiratory sort of was affected, system was affected. So he had sort of a blocked nose and feverish feeling, maybe a slight sore throat. You can't really say it was a sore throat, but more like heaviness, and you just feel like you're not up to being normal. It could be anything, that sort of thing. And that went on for about a day or two, probably, where he felt like that. So he immediately contacted our the doctor that was open nearby, and we consulted over phone because again exposure is a risk in general.
Right.
So we could just figure it out on the phone because it's so mild. I mean, we didn't really expect much there.
Right.
So he was the first to sort of show those symptoms, and he complained of losing his sense of smell and taste in about the second day or third day. That's when, I mean, I didn't even understand it then. At that point, I said, that sort of happens when you have a cold. But he was saying, no, this is different. I feel zero. Like I just can't, it's stinky stuff in front of me. I can't smell the garbage. So that seems to be a little alarming to me. That was shocking. And poor guy, I mean, he kept saying it to me, and I said, "No, don't worry. It could be something else. Let's figure it out," is what we said. But our general practitioner actually was helpful. He sort of started him off on, to rule out other things, he started him off on antibiotics and antihistamines.
Mm.
And after that, my mom actually showed, it sort of went to, however it began, it sort of directly became a sore throat.
Right.
Like a bad infection for her. Her throat was infected. She was really down. And in general, her immunity, it's not like she has a pre-existing condition, but her immunity was a little low at that point in time anyway.
Right.
So seemed to have a fever. It was a low grade fever. It was about maybe up to 100 or 100, maybe 100.5 or so. It went up and down, and it would only go down with paracetamol and come back up in the next few hours, whenever the effect was gone. And other than that, she complained of a little bit of body ache. But then when she said her joints were paining a little, we thought, chalo, this needs a little bit of attention.
Mm.
And we take her to the doctor. We spoke to that same doctor. We said we'll come bring her the next morning. By then, I had the same, similar symptoms. I had a fever. I had again up to 100. And mine was a very weird feeling in my throat. It was, I can't call it a sore throat, but it was something at the back of my throat that was really, I can't even say itchy. It was sort of paining. And no cold, like nothing to do with the nose, but it was a severe headache. It was fever. Fever led to severe weakness right after. And in one day I thought, how come it sort of got to this? But whatever, we waited and we said, chalo, we'll go to the doctor and check.
Right.
Three of us went to our GP the next day. And by then we were all sort of started off on, my brother continued his antihistamines and my mom needed the most attention. What the doctor said is at that point our throats didn't look as bad for my brother and I. But for my mom, it did look bad. So he said, now we don't know whether it's a bacterial or a viral for that matter. So he actually recommended we wait for about a day and a half. And if either her symptoms get worse or they don't go down, we get her tested for COVID. So he wrote down a prescription for us there and then. And we were sort of ready. We said, chalo, we'll start on her meds and we'll see what we can do thereon. Now, after that, her fever actually just didn't change for the next few days. It was, mine went down, mine stopped at some point. For my brother, it was, he never did have a fever. So that feeling sort of reduced. Again, I lost my sense of smell and taste and I thought, okay, this is just crazy and we should get ourselves tested. But we thought, let's start with my mom because she has a prescription anyway and then we'll take it from there. And for that particular week, this was the first week of May, even the private labs in Bombay had a certain rule where they were not testing at home.
Right.
So we had to, unfortunately for us, we had to go to the private lab that's closest. I'm sorry, just a second. To the private lab that's closest. And what we did is, my husband and I actually went and we took my mom along. And we decided even if she does come back negative, we'll make sure we are quarantined for 14 days and we don't sort of contact with other people just to make sure and just
Right.
to stay.
Right.
And so a small experience at the center itself, it was crazy. It was really, really crazy. The requirement for an Aadhaar card was one thing, but in general, there were lines of people and to keep, to keep the rules in place there was becoming difficult for the administrative people there. We could really tell, and that was really unfortunate for those guys. But yeah, so we got back with that test and in about 24 hours, we got her positive test back. That's when we sort of sped up everything else.
Right. Right.
Would
But
you
she
like
did
me to
not,
share?
she
Yeah.
didn't need to be hospitalized.
Actually, so right after that, our municipality got in touch with us and they asked us how many people were at home. They asked us whether we'd be able to manage with home quarantine based on her symptoms, because again, there was no sense of breathlessness for her and no
Right.
low respiratory issues at all. But they did recommend we get her hospitalized actually, because they said the washroom is common and you don't want the infection to spread thereon. But there was a lack of beds at that point in time in Bombay, and it was, we had to make, they were poor guys, they couldn't help us anymore. So we had to make separate calls to hospitals and check. And for about maybe 3 days, we kept trying. And we told them, no, we'll try. But after 3 days, her fever also, this is after 3 days after the test, probably, her fever was still not gone, but it was much lesser.
Right.
The span of the paracetamol working was also increased.
Right.
Then by then the doctors at the BMC also said that if you are home quarantining and if you're able to manage, we'll keep in touch with you, and then that's about it. You can just manage with home quarantine. So that's how we decided. Then based on their decisions, we also spoke to other doctors at the front line of COVID, and we asked them whether this makes sense, and then we sort of went ahead with home quarantine.
Right. Right.
Yeah.
And given that you all were 8 of you all, and as you said, you have an aunt who is even older than your mother. I think you've told me that your husband has a comorbidity as well, or a
Yes.
pre-existing condition. So how
Yes.
did you ensure that people were not panicking at home, uh, and also following all the guidelines, and how did you kind of manage this?
Yeah. It was extremely stressful because with my mom anyway, like I mentioned, she was already in a room, and since my brother and I already had symptoms, we decided him and I will be the only people that go in and out of that room. There's no chance anyone else is involved. And everything to do with disinfecting after her, the bleach, the solution that we made, all of that usage, him and I stuck to. With my aunt, this is everyone in the house that we wore masks practically all of the time. The air conditioner was sort of not used after that, and windows were open as much as possible. And I mean, I can't.
You talk of how many times you clean with Dettol, right? So
Oh gosh, and I tried to count how many times I washed my hands in 3 hours. It was 33 times at one point. My hands were dry. It was crazy. And I don't know. I mean, we still followed guidelines, but it was still, you can't call the doctors every few minutes. So you're sort of
correct.
there. And it was all duties in one for us. So for my aunt, definitely it was the fact that she will wear a mask.
So Dr. Ekta and Dr. Ankit, did you kind of feel weak after having, and if the audience wants to start asking questions, please do write it in the Q&A. Did you feel weak after, like a lot of virus infections in general make you feel quite weak, and you take time to recover. So was that a challenge as well here?
Yes. So any virus, if it gets into your body, it will break you, and you are bound to feel weak. So basically, during the period of hospital stay, we were most of the time resting in the bed. So we didn't really feel much problem there. But once we got back home, we were just the two of us. So then was the time when with work, we used to definitely feel weak for around 4 to 5 days.
Right.
And also with slight exertion, there was good tachycardia. The heart rate used to go up to 130, 40, which settled down after 20-25 minutes of rest. But that weakness was there for almost a week. Yeah.
Right. And did you need to do anything to kind of recover strength? Did you exercise anything, or just let it take its course?
We did very, very, very mild kind of yoga so that we didn't want to exert ourselves too much.
Right.
We did 20-30 minutes of yoga every day.
Right. Okay. And were you scared to go back to work, or were your colleagues scared of you coming back?
Yeah.
I know
No,
you're
we were
in the profession, but so it's probably hopefully less.
We were looking forward and they were waiting for us too, because the patient load and the workload was so much that actually they missed us.
So for her, everybody in her lab got tested. So there was one person who was positive, who isolated. So for me, those who were in contact with me were also isolated for the next 7 days, and none of them actually developed symptoms.
Right.
So after that, a few who underwent testing, but then everybody was negative. So really speaking, they were looking forward to us to join. Yeah.
And since we were both tested negative, so there was no fear at all.
Right. Okay.
Yeah. So I was more worried about my patients. I didn't want to be a source of infection to them. So that was one more reason of getting ourselves tested again.
Right. Absolutely. Hi, Pradnya, you're back again. So just wanting to understand, just wanting to understand how you all managed, and as you were saying that there was a lot of stress. at that time,
Yes.
and how did you uh, reassure your mother as well as your aunt and everybody else? So if you
Yes, it
share
was
that.
actually very stressful. And although by now we know maybe a little more about the virus, and of course, nothing maybe enough, but at that point in time, it was very scary because we personally didn't know anyone that had COVID in our circles. Well, the media doesn't help either. You just don't know what to expect as such. So it was a little scary. But I told my mom, I mean, we're in touch with doctors
Mm,
and keep backups for hospitals. We sort of said, this is the closest to us. In case of an emergency, we'll just rush her there. We kept ambulance services or sort of on standby. So I
right,
told my mom, we'll manage that way. And we had a pulse ox meter as well at home, and we had a BP machine because, like I was mentioning, my husband has a condition of polycythemia, and he also did have symptoms. So that was the most difficult for us because we were not at that point in time. We were just they were out of kits, is what we were told. So testing was very difficult even for him. He's 32, so they
right,
said immunity would help him. But we were constantly monitoring his BP, and it did shoot up for about a week and a half.
right,
What his normal levels were, which are already a little heightened, it was even higher than that for about a couple of weeks, which leads to severe headaches and nausea and things of that sort. And getting in touch with the hematologist at that point in time was also very difficult.
mm,
And I mean, since you're not stepping out, what else can you do at that point? So
right, right,
someone had to stay calm to begin with. So my brother and I thought, no, let's just do this the way it's to be done, because if we stress and reflect that on everyone, it'll be very difficult. So we had to take it literally a day at a time, maybe a few hours at a time, keep revisiting those dissidents to see if we could maybe change something and help everyone at home. But with
right.
she actually has iron immunity, and in general she's very what do you say, she's smiley and things of that sort, so that helped bump our spirits as well. We thought, just look at this lady, she's being so nice, so let's just pick up that cue from her. And
Right,
whatever is in our control, at least we'll definitely do.
right.
uh, it was
And did you have, since you all were so many of you and you all were home quarantined, unlike the doctors,
yes,
were there issues with neighbors? Were they concerned? And then you
yes,
also have your dog, were you able to take the dog
yeah.
out for a walk and things like that?
Actually, we were one of the first cases, one of the first few, I think, cases in our area, in our locality. So it
Mm,
was very difficult in general for the people in our locality to fathom where it came from, which again, like I said, we don't know as well. So
right,
we're getting questioned on that, and they sort of, I understand it's curiosity. So they were just trying to ask us where it came from or what we did wrong, or did we go out too many times? And we had no answers for them because we thought we were doing the same thing as most people were, which I guess we were. So that was a little, I mean, you're just dealing with making calls to hospitals, to our municipality, to many other authorities, to the police as well, because they keep a check on you almost every day. And meanwhile, we were getting these calls to sort of a little, it's not even neighbors in general, maybe distant family also. They were curious, I understand that, but in that frame of mind, it's very difficult to answer those questions and give them the answers they need. I mean, it's not
right,
very difficult. Um, so that's why that was a very bit difficult to deal with. And in our building, we don't have like a complex, it's a single building. And a lot of our neighbors were actually very supportive in that sense. They said, whatever you need, you'll help. And our friends were really, really supportive, because deliveries, groceries, all of those things that you don't really think about, they come
mm,
into.
right,
um, so we had to sort of manage that, and they were really wonderful. They would somehow manage to get it to our gate. We sort of basket pulleyed it, sort of down through our balcony, and we managed to get our stuff up. But we needed help for that, so we're really grateful. But yes, a lot of people were paranoid. They didn't. Technically, we were supposed to be allowed to go down to our community bin and sort of drop our garbage there, but
right,
we told not to, which I understand. But it was sort of, to deal with that at that point in time was too much, because again, we had to convince the authorities to make sure that we are not allowed. They should come to us. So
right,
we had to sort of mitigate our way through all of these things. And you just don't consider that these small problems exist when you are at home, because yes, on some level it is easier if you are at home, but on another level there are these small difficulties that lead to what can I do? What if I, run out of supplies, or I need my garbage taken out because it's biohazardous stuff at home as well.
Right,
So
right.
really, for the first 3 or 4 days, it was difficult to manage that as well. But a couple, like I said, a couple of our neighbors were really helpful. They spoke to our local corporator, and they got a lot of things done for us as well. On the other hand, there was paranoia, so it was half and half. And I'm hoping that we more help each other in this, even virtually, if situations like this. So
Right, right.
one can hope for there.
So a couple of questions that have come in. One question is that, and I guess, Doctor, you can answer this. Is there any chance that the infection would go without any medicines? Is one question.
So basically, there is no medicine yet that can fight the virus. As of now, we do not have any evidence-based medicine. There is one which has shown some advantage in terms of reducing the duration of symptoms, but not definite advantage in terms of survival. So anything which is going off is without medicine, for that matter, apart from the symptomatic treatment which we are given. There are some form of therapy like plasma therapy which have shown encouraging results, which is probably because we do not have anything else at the moment.
Right, right. And how long should one wait for a COVID test if you have a sore throat? And I think to me, this is also linked to one more question, so I'll combine the two. If you have any symptoms, what should you do? Can you test immediately or only after doctor consult? And COVID infected, yeah, I think those are that. I think you can combine those two questions.
So basically, when you have a symptom, the first thing that you should do is consult a doctor. I suggest you consult over telephonic because going to a doctor's clinic is exposing others. So if the doctor says that you should get tested, then I think you should go ahead and get tested. But sometimes the doctor doesn't agree to your symptoms, and they feel that it may not, the COVID testing may not be required. In such cases, I feel that if one person is feeling that I may be COVID positive, the best is to isolate himself in the house, at least for 10 days. If no symptom develops, then maybe he can go out again.
So, and another issue is the healthcare system is getting overwhelmed. There is no doubt on that.
Correct.
Getting tested is increasingly becoming difficult day by day. So, as of today, any flu-like symptom should be considered COVID unless proven otherwise. So, any symptom of flu, you should isolate yourself if you are not able to get tested. Get in touch with a doctor, stay isolated in a room, and just keep monitoring yourself.
Right.
If there is any increase in symptoms, try to get tested, yes. But to begin with, isolation is what will be required in the near future.
And even if you get tested and it becomes positive, there are hospitals who are already full. There is no bed available. So asymptomatics are not kept in the hospital anymore.
Right.
So doctors advise them to stay at home, isolate, and monitor yourself.
And also, a single negative test in a symptomatic patient doesn't really completely rule out initial part of the infection. So it's all the more better that just stay isolated and just wait for it.
Yeah. Okay. So, and I guess there's also then the issue of, if you're opting for home isolation or home quarantine, then how do you monitor to ensure that when you need to get hospitalized, you do get hospitalized? Because, if the symptoms get worse, then you do need to ensure that you get proper, maybe ICU or maybe ventilators or whatever are required, right? So.
See, so basically what we need to understand is not everybody will require hospitalization. So at the beginning, it is important to get in touch with a doctor. So he will guide you if you have comorbidities, if you are elderly, or if you have any sort of immunodeficiency. Those are the high risk patients. Those need to probably get into the hospital. So that is why a doctor is required to be in constant touch with. Having said that, mostly say 80-85% of the patient otherwise recover with mild to moderate symptoms who actually do not need hospitalization.
Correct.
So that has to be remembered, and the high risk patient has to be looked into, and also self-monitoring, as I had mentioned, with pulse oximeter, temperature, all those things should be looked into constantly. And any sort of deviation there, one of the most important symptoms is respiratory difficulty. If that begins, you need to rush to the hospital. So that's why a doctor have to be kept in the loop so that any aggravation in symptom can be informed promptly.
Right, right. And when you are, Pradnya, kind of having gone through this, are you more careful, or do you now have a sense of, I've already, been through this, and therefore, I'm strong enough to deal with this, or I'm immune? What is the kind of thought process that comes in?
Well, for me, more than anything, I mean, we were not tested. So honestly, we're maybe 5 of us had symptoms. Only my mom tested positive, and she did get a retest later. But well, regardless, the rest of us didn't. And again, we're not sure. So we still have to be careful, and we'll keep with that. My job does ask me to get out of the house on a daily basis. So that's not happened as yet. Particularly not in Mumbai for sure, not as yet. And even if maybe later in the month or maybe next month, if I do so, I don't think I'd sort of put my hands up and say, hey, now that I've gone through it, I'm completely immune. But if there's any way that I can help, and if I'm at an advantage in any case or whatever I could do, maybe I could sort of help out. Like, let's say if it's neighbors and I need to drop off something at their house or something of that sort, maybe I'll feel a little I can't say confident, but I'll feel a little like I could do it or something of that sort. But again, we don't know enough about the virus, so I go by that. I mean, all of the precautions that we were taking, we're still taking in that sense.
Right.
And not that you need to take it lightly, but also that my bigger thing was we need to be with each other through this. Like if, I don't know what to say, like the paranoia sometimes goes above everything else. And I really hope that doesn't happen with this infection and the way it's taken over our lives. That's really unfortunate about it. That's all.
Right, right. I guess a couple of other questions that have come in. Does steam inhalation help in preventing an infection or help in recovery? I guess Dr. Ankit or Dr. Ekta, one of you can take the question.
Yes, because I did have a stuffy nose also. There was a slight stuffiness, and this steam inhalation actually helped me. And it was quite relaxing taking that steam inhalation on and off at least twice a day.
So it at
One
least
more
helps in
problem
symptom
is all
management,
cough.
right? Sorry.
Yes.
Yes. So all the cough syrups and stuff which might be required, it actually dries the throat, which increases irritation. So steam and gargle are the way forward. They keep the tract open and moist, and you feel much better and comfortable.
Right, right. So there's a question that's come which says, I don't have any symptoms, but as a precautionary or an early warning measure, should I get a pulse oximeter and monitor every day? Any thoughts?
So it's good to have a pulse oximeter, good to check the baseline oxygen saturation on one single day, and then just to keep it until you really develop symptoms. There is no really any requirement to keep testing yourself every day.
Right, right. And I think there's also this, there's also the question of what kind of masks that, are useful. Are cloth masks good enough, or do we need 3-ply? There's still this whole discussion happening. And what kind of cloth mask? Because you see a range of cloth masks, right? People will have just a dupatta tied around their face to, handkerchief kind of hanging somewhere. So if you would like to, and I know you've got a few slides, so maybe if you can just quickly run through that, that will help address the concerns on that. So I'll just share the slides, yeah. So if you want to just quickly talk us through, Doctor.
Yes, so basically these are the 4 essential things which we need to do in the next 1 year maybe. Hand washing, with soap water at least for 20 seconds. Whenever hand washing is not possible, sanitizers, masks, well, different type, lots of discussion. I'll try to give throw some light on that, and social distancing. So basically, there are multiple types of masks. And what we need to understand is the viral transmission happens through the virus is suspended in the environment in form of droplets and particles. So, and the amount of viral exposure actually determines to some extent the symptoms which you are going to develop and the severity of it. So wearing any form of mask prevents droplets. And droplet has the maximum concentration of the viral exposure. So even cloth mask is something which can be worn and cheap, readily available, easily recyclable. So this is what the community should adopt. So if somebody have access to surgical mask, welcome, it can be used, but it has to be of proper build. I mean, the make should be proper, it should be triple layered mask, and the quality should be ensured. So apart from that, the N95 respirators is not meant for common public who are not at high risk of exposure. It is meant for those who are actually at very high risk, like healthcare workers, police personnel who are constantly coming in contact with people, and all other people who are actually getting a lot of exposure daily. So because of the scarcity of supply, the cost is going up and there are lots of issues. So those N95 respirators should be reserved for those at really high risk of exposure. Cloth masks and to some extent surgical masks are meant for common public at the moment. Yeah. And what needs to be emphasized is everybody should wear mask. Like if I am wearing and somebody else is not wearing, so, you know, both are at some risk, increased risk. So if everybody of us wears mask, the exposure level significantly comes down. So CDC actually, this slide shows that it recommends cloth mask for general public, and that's exactly what I said. And the other respirator are meant for high risk people. So another important thing is how to wear and how to remove mask. So each time before wearing, the hand should be clean. The mask should not be constantly touched with hand because the outer surface might be harboring the infection. So each time the outer surface is touched because of any reason, hand should be immediately sanitized. And after removing it, hand should again be sanitized and it should be discarded in a proper way, disinfected and discarded in a proper way. Yeah. So Ekta will tell us something about the surface decontamination.
So we should use gloves while cleaning, and for dirty surfaces, detergent is enough. Any kind of detergent, especially sodium hypochlorite is the one which we should use wherever possible. At home also we can keep 1 to 5% of sodium hypochlorite, and we can bleach the surfaces and whatever. If a COVID infected person is there, we should definitely bleach everything that he has touched. And for instance, when we were infected, we accumulated all our garbages at our home, and we did not give it to the waste person who used to come to collect the garbages. And only after 28 days, we removed it from the house. Although the place was stinking, but then we did not want anyone to get exposed to that.
So apart from that, what is important is sodium hypochlorite, when it is used, the minimum exposure times should be 1 minute. And whatever solution we prepare should be used within 24 hours. And if like electronics, which mobile phones can be cleaned with 70% alcohol-based sanitizer, but it should be ensured that it doesn't go into the ports, so it get damaged. Linen can be washed. Warmest setting in the washing machine is recommended. And excessive shaking of infected material should be avoided. So these are some things which we can do in our day-to-day practice to minimize, infection. And anything which is coming in, yeah. So these are the things which we recommend that every household should have at the moment. Thermometer is something which is present in all the households. So infrared thermometer is not for personal use. We would not really advocate it because in my case also I observed that core temperature is the best, and infrared gave erroneous result many a times. BP instrument is handy, and pulse oximeter is something which is very important at the moment. Monitoring with the increasing number of cases and hospital getting overwhelmed, there will be day when people will have to be isolated at home. So monitoring will be upon ourselves. So these are the few things which, if present at home, will make things a bit easy, because once we get infected, access to things become very difficult. You need to be dependent on somebody to get things at your home because you don't want to go out of the door. Yeah.
That's when we realize that being independent is so important.
So there are some pearls which I would like to mention. Most important is to keep yourself very well hydrated and have a good diet. This is not a time to go dieting. And immunity booster, whatever you come across and you have evidence towards the use of that immunity booster can be used. Most important is vitamin C. Household turmeric and honey are good to go. But yes, whenever you use some Ayurvedic product, it has to be ensured that it is backed with some evidence that it should not cause any damage to the body. Maintaining social distancing is the most important thing, which has to be followed for almost a year from now. And medical help is sought as and when required. And it is very important to stay calm and not to panic. So these are a few points which I would like to go in as a message.
To be educated about the virus and to be aware of the virus is more important than being panicky.
Correct. I've got a couple of more quick questions. I think you've kind of answered that, but I'll ask, what's your call on sanitizing hands frequently? But I do know that some people, if they try and sanitize too often, then they end up having skin issues. But if you have anything to add to that, Doctor.
So whenever you have access to soap and water, that is the best to do. And sanitizer, maybe whenever you touch your hand against any surface can be a source of contaminant, sanitize your hand. But yes, whenever there is access to soap and water, that is the best.
So for people who have dry hands and it gets dried because of sanitizer, I would say that they can keep a small moisturizer pouch in their bag. They can definitely apply that moisturizer after sanitizing.
Okay. And there's a question that's come whether you were troubled about your accommodation and food at I guess the hospital, at the center, she says, but I guess it must be the hospital.
So hospital for us was not much of a problem. Yeah, so this was for Pradnya?
No, it was for you. I don't, because this is
so
at the center, so yeah.
I was admitted in my hospital, so
right.
So things were not very difficult. But yes, the hospital food gets a bit difficult to take in after 3 days. So we had faced that problem.
But they were quite cooperative.
Yeah, at home also, the society has been very cooperative throughout.
Right. Can a single N95 mask be used daily?
Yes, so controversial question again. If I code the CDC, and that is what we are doing at present, we have a set of 4 masks, each kept in a paper bag. We have numbered them from 1 to 4. I wear number 1 today, come back from work, fold it and put it back in the bag. Number 2 tomorrow, number 3 the day after, and so on. And on the 5th day, I come back to number 1. And after five uses, I discard them altogether. So that is what the CDC says, and it is difficult to buy for the hospital to buy new masks for each of the consultants daily. So this is what we have been doing, yes. And this is what the CDC is also recommending.
Right. Okay. We'll just kind of run the polling just to get some feedback as well. So if people are watching, you can please share your feedback. I think one other point that keeps coming up is whether cloth masks are as effective, and obviously they are not. But what is the value you get of making sure that everybody uses cloth mask? I mean, it's not as effective in terms of even limiting the droplets, but there is hopefully a reduction in viral load, and therefore, so if you can just talk us through that so that people are reassured that there is value in a good cloth mask, and also if there are any guidelines on how the cloth mask should be, or how do you ensure that it's not just a patch of dupatta?
Yeah, so cloth, as I told, that droplet and particles, cloth mask to a good extent limit the particles. So basically, the droplets are definitely limited. If I am infected, I am coughing, and if I have a cloth mask, I will limit the droplet spread to the environment. So that is one advantage of an infected person wearing it.
Right.
Second, if somebody who is in close vicinity to me, some droplets which might have gone out will be prevented by the cloth mask. Viral particles, cloth mask won't be able to prevent, yes, but viral particle will be a much lower viral load which a person in contact will have, and that to some extent guides the symptoms. So wearing mask is protective for anyone. I mean, cloth masks are easily available, so that is one thing which everyone in the community can wear.
To this, I would like to add that every other seller, if you see, are selling now the cloth mask. We can just on our own judgment, we can just decide which is better. At least that cloth mask should also have a three layers should be there. Just a dupatta or a handkerchief is still not enough, I believe.
Right. And also, I guess you should make sure that you wash your cloth mask regularly and
Each day, yes.
and not keep touching the cloth mask from the front,
Definitely.
right? So
Definitely.
use the loops at the side. So
Yes.
okay, I think we've learned a lot today, and thank you for sharing your experience. Really, I think it's good because after we announced the webinar, we've received so many more people sharing blogs and videos of people, and I think the more people share and come forward, it will help reduce the stigma and the fear surrounding COVID-19. And as Dr. Ekta said, we need to be careful, we need to be prepared, but we don't have to be afraid. And we do need to manage existing conditions as well, existing chronic conditions well. So we can't ignore those conditions as well. Just one final question that's come in: how to sanitize daily materials like specs, watch, pen, laptop bag, belt? I think you touched on this in your surface, but if you can just quickly recap.
Yeah. Alcohol-based sanitizers. Bleach is not recommended for everything that can damage delicate stuff. So 70% alcohol-based sanitizer is good enough.
And for the things that are edible, like the fruits and vegetables, do not consume it immediately. Keep under the sun for some time, for 2 hours or two, and then wash in the hot water, and then maybe you can use it after that.
Very crude, no evidence, but we can do that. We have been doing it.
Since we cannot sanitize with alcohol.
Right. Okay, thank you so much. Thank you, Pradnya, for sharing your experience as well. And thank you, Dr. Ekta and Dr. Ankit as well. And,
Thanks a lot.
hope
Thanks a lot.
you are
Really
able
enjoyed.
to donate for plasma therapy for somebody as well. So
Yes, in this week we are planning to do it. Yeah.
okay, all right. Great. So thank you. Thank you, everyone. And thank you for all the attendees who've joined and who've uh, hopefully learned from this session as well. Thank you, everyone.
Thank you.
Thank you.
Stop
Thank
the
you.
live stream.
Bye.
Bye.